The one thing I wanted you to know is that I mentioned that we could now help any person with bipolar, at least to some degree. And
Yeah.
the best thing we can do for them is to prevent it from getting worse. Even more exciting is there are studies now showing that most people who get bipolar have a parent with bipolar or a medical history of bipolar. And it appears that the average person is not going to get bipolar. The genetic heritability is so great.
Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, where we talk with people about their own recovery stories, success stories, using nutraceuticals and herbs and feeding their brain effectively. We talk with high-level scientists. We talk with practitioners who have been using this approach often for decades with their client. And today I am delighted to introduce Dr. William Walsh, whose work I have been following for decades. And he, with Dr. Pfeiffer and Dr. Hoffer, were among the pioneers in orthomolecular psychiatry. So these are the shoulders upon which we all stand. Dr. William Walsh is an internationally recognized expert in nutritional medicine and a pioneer of nutrient-based psychiatry. A former nuclear scientist at Argonne National Laboratory, he shifted from weapons and energy research to study brain chemistry and behavior. Thank you very much for doing that, Dr. Walsh. Leading groundbreaking work on violent offenders and building one of the world's largest biochemical databases in mental health. What a legacy. He collaborated with Dr. Carl Pfeiffer to develop nutrient therapies targeting methylation, metal metabolism, and other biochemical imbalances and conditions such as ADHD, autism, depression, bipolar disorder, and schizophrenia. Dr. Walsh founded the Pfeiffer Treatment Center, which treated more than 30,000 patients, and is president of the Walsh Research Institute. He continues advancing evidence-based nutrient therapies used worldwide. I could go on and on and on, but we'll stop there. And I have some very specific questions for Dr. Walsh today. One is for him to share with us his specific approach working with people with cocaine addiction and with opioid use disorder, as well as other substance use disorders. But then also, he recently published this astonishing book on bipolar disorder. And so we're going to spend at least part of our conversation doing a deep dive bipolar disorder, both as a disorder of oxidative stress and of genetic anomalies. So, Dr. Walsh, welcome.
Well, thank you very much. By the way, I want to mention that my mother's name is Christina, and my only
Oh,
granddaughter is Christina. So pleasure to talk with you.
thank you. So, I'm not quite sure where you would like to begin. But you did mention that you used to not treat people with certain addictive disorders because you weren't successful until you found a very successful approach. Can you share that with us?
I'd be happy to. My original beginning was trying to find out why people are criminals and why, and I got involved heavily with behavior disorders and got into the science of it and started getting lab testing of people in prisons and violent children, and eventually got a huge database of, for example, I have a database of more than 6,500 people with ADHD. And then for behavior, I've got a very large database of more than 10,000 people. And so I have a chemistry and symptom database of really millions. So probably at one time I know it was the largest in the world. And we learned a lot from that. And realizing that a lot of it had to do with, for some people, metal metabolism. For some people, it was toxic metals, although we found out eventually that was 5%. Anyway, we learned that we were able to help these people, and I started collaborating with Carl Pfeiffer and Abram Hoffer, and originally with schizophrenics, but then he got interested in my behavior studies. And anyway, with his help, I would go to Princeton and I would bring him maybe 50, 60 files and we would work on them together. I would get the lab
Mhm.
work and everything. And so I had a great man to work with me, a wonderful man who didn't care about money. He's one of the happiest people I ever met, but he loved helping people. In his time, he saw more than 20,000 schizophrenics and was actually nominated for a Nobel Prize for his work, which I think he deserved, but of course did not get. But anyway, he urged me to start a clinic in Illinois for behavior and for mental illness, and I did that. I mean, he kept pushing me into doing it, and so we did form it and do it. We eventually saw, I think, 35,000 patients. So I have worked with directly 3,600 diagnosed with schizophrenia, 1,550 with bipolar, and then a lot of, depression and all the rest. I don't want to go into all the details, but we were quite successful. I think my upbringing was as a scientist, and I originally was doing work in nuclear physics, and I don't want to talk about that. But what I did find out was that we would do outcome studies, and I found out who got good at well and who did not get well. Now, of course, with the behavior disorders, especially old people over the age of 12, a lot of them had drug problems. And I found that marijuana wasn't so much of an issue with respect to helping them. But wow, if they were taking cocaine or heroin or stronger things, we found that our outcome studies said that our success rate was terrible for people who were addicted to those kind of drugs.
Right.
And for a while, we stopped seeing them. And the reason was we didn't want them to waste their money because we knew that we couldn't help them. And then we didn't want to waste, of course, our time too. So something happened just in the last 10, 15 years, and constantly following the neuroscience and the research going on, I discovered that there had been some real progress on this. And what they found was that first of all, we knew that people prone to this tended to be undermethylated, which
Mhm.
Christina knows all about. And that tends to make people more obsessive compulsive. But most of the people we saw with that problem, I'd say 80% had undermethylation, which is one reason why they respond well to protein, for example. They are genetically low in protein. They thrive on protein, which is something that Christina knows all about.
I do that. That 20 grams of protein every 4 hours helps significantly with this population.
See, I didn't know that. And in fact, I didn't know that until you just told me now. But what I did find out was that a very large number of people who were addicted to cocaine and whatever, heroin, whatever, many of them, turns out, not only we knew that they tended to have low histamine levels. We knew that. But just correcting that alone didn't seem to have any major effect until we got the number of studies, and I'm talking about many classical scientific studies are showing that it has a lot to do with NMDA activity, the glutamate neurotransmitter at NMDA receptors, and they find excessive glutamate activity. And there is a nutrient
Excuse me just for a second. Is this before or after they have been using these drugs for a period of time?
This is research from researchers who are studying addicts.
Right. So we don't know the glutamate activity before they started using. We just know it after they have developed an addiction.
By studying thousands of them, they found that many of them had extraordinarily high glutamate activity. So they've discovered that scientifically, and there are really, if you dive into it, you'll find dozens and dozens of very nice peer-reviewed journal articles. So it's just the
Nice.
science of it. It's not nutritionists doing their own studies, but it's classical. I call it hard science. And so it began to understand what it was. And we have an ability now with nutrient therapy. I like to call it epigenetic therapy more because it affects neurotransmission. But we now have a way to make a real dent in that. And it has to do with things like N-acetylcysteine. Now, N-acetylcysteine has a unique mechanism, and it's something called the anti-Porter effect, where what it does is it sharply reduces neurotransmitter glutamate activity. And now there are many studies on that with respect to obsessive compulsive disorder, shopping disorders, cigarette disorders, but most importantly, opioid disorders and problems with all the various kind
And
of
cocaine.
yes, the illegal drugs. And again, I think I mentioned that maybe that marijuana was not much of a in terms of brain function and all. People talk of it as a gateway drug, but we've learned that we can help people if they have a marijuana. But anyway, we started doing this 5 years ago. One of the things that my organization does is we train and educate doctors. We now have more than 1,200 doctors, many of them psychiatrists, and most of them regular doctors. And we trained them in this. And we now have hundreds and hundreds and hundreds of people who are addicted. And we're finding out that the research was correct. We can help them. We have to first do the chemistry and make sure that, in fact, they do have the undermethylation and all of that. But if they're undermethylated, they have low intrinsically because of genetics. They have a tendency for very low serotonin activity, but especially low, excessive glutamate at NMDA.
Can you give us a sample protocol of what you would do
Absolutely.
with one of these clients?
Absolutely. And the good news is it seems quite successful. And I think for someone like yourself who already has a protocol that can help them, this might be something that could, another weapon in your arsenal.
That's right.
And I want to know about protein and all that you've done, because even though I'm not doing clinical work now, I'm training many, many, many doctors to do this. And so I'd love to learn more. But the only negative is you need a fairly high dose of N-acetylcysteine, and we start with a dose of 500 or 600 milligrams, which is one rather sizable capsule, and it's a nutrient. But for some of them, you have to go to as many as 3 or 4 grams, but that's all right because we know that it's safe.
3 or 4 grams. Okay. Because I know the research that I've read talks about 2,400 milligrams. So 2.5 grams for mania and OCD and that sort of thing. So you find that sometimes you need to actually double that.
Some people get better on 500 milligrams, but if it's really a severe addiction, and especially if they're severely undermethylated which means the severe glutamate and serotonin issue, then you often they have to go to higher, and people are now taking it in powder rather than getting this done is not a problem. And one of the really nice things is it helps people, just as the literature has said. We're finding that the literature was correct, and people have done these studies that we can actually help people who are still abusing the drugs, and it
Nice.
really helps them. If you have somebody that you want to help and they haven't stopped yet, you can start treating them, and within 4, 5, 6 weeks, they're much more capable of stopping.
I've got two questions right there. One, do you have other nutrients around the NAC? But before you get there, how specifically biochemically does the NAC work to tame down the overactive glutamate system?
Well, the glutamate system is one of the most peculiar of all of our neurotransmitters. And it's considered a bizarre kind of neurotransmitter. And what happens is with glutamate, when the glutamate fires, you get the glutamate into the synapse. but it does not have reuptake. It doesn't go back into the neuron. It goes into glial cells, astrocytes
Ah,
that surround the neuron. They either do or do not pass into the membrane of the astrocyte, and it's called an anti-Porter effect. And we've learned that N-acetylcysteine has a unique ability to really affect that, and therefore
wow.
affect the glutamate activity.
Do we know how it does that?
Yes.
I know I'm getting to the nitty-gritty here, but that's how my brain works.
The answer is the scientists know that, and it's there. And a lot goes on in astrocytes in NMDA, and that's where memory resides. It looks like a clumsy, inefficient neurotransmitter, but that's how we get memory and how we get a lot of
Okay.
OCD. Basically, is a failure to get rid of memories that you don't want, and
Yeah.
that's why that has so much to do with OCD. But at any rate, we've been doing this now for I think 7 or 8 years. We started cautiously, but now that's a therapy and a protocol that we teach everyone. Every spring we do a training. Every spring we
Mhm.
do one, I think in March and April, and the number is growing. We're it'd be great if we could get up to a couple thousand docs because that's a lot of people. And we know that we already have more than 1.5 million people have been on our protocols, but maybe
Mhm.
last 100,000 had this available.
I know I very much wanted to take your training about 10 years ago, but you didn't offer it to non-doctors, and so I couldn't slide in. So
Yeah,
that I was very
I had
disappointed.
I had medical doctors on my board of directors. We're not for profit, and these medical doctors were just said, "It's got to be doctors, got to be doctors." Well, we've loosened that a bit. If you applied today, you would be welcome. Okay,
Thank you.
yeah, and we've had some brilliant people who may not
I
have.
just I just might.
So anyway, that's what happened with that, and that we're still getting. It's only been the last few years that we've had a lot of doctors doing this, but I'm hearing really good responses from in many cases that people they can now help people they couldn't help before.
Now, is it a monotherapy, or are you, with your testing, combining it with whatever other biochemical pathways need supporting?
Well, we know that we have to, if a person has a metal metabolism disorder, for example, if they have extraordinarily high copper or if they're zinc deficient, which is really common, we really need to fix that. But we know how to do that rather easily. Somebody has undermethylation, we have a treatment for that, and that also acts directly on the NMDA. So yes, we to do this correctly and properly, I think you need to do everything we were doing before, but focusing on undermethylation and on correcting the neurotransmitter, especially the glutamate. You have to really need to fix both serotonin and the glutamate, and we have protocols for doing that. It's one of the wonderful things about epigenetics. We actually for example, acetylcysteine and methionine, which are methylators, they
Mhm.
are serotonin reuptake inhibitors.
Are they?
They are
Okay.
serotonin reuptake inhibitors, and we know how to increase and decrease expression of serotonin and other neurotransmitters. We can do this because of epigenetics with nutrients and solid
Mhm.
science. It's solid science. This is not guesswork. So
No.
that sort of covers what we're doing, and since you have a strong interest in helping people with addictions, I wanted to make sure that you knew that this was a surprise to me and a delight. Really, I felt sorry. People would begging come to our clinic, and we wouldn't take them because they were still on heavy drugs.
Now, you mentioned that THC or cannabis use disorder is fairly easily addressed using your various approaches. What about the people who have triggered a schizophrenic disorder as a result of using high levels of THC? What is your experience and success with that? Because that, I keep running across that and it's highly problematic.
Well, what I'm saying is that if a person has a behavior disorder or depression and they're taking some marijuana, we can usually help them. But
Right.
marijuana is a terrible thing, and it's a negative. It changes a person's brain. I once was working at our national laboratory, and there was a rather brilliant man named Russ back in the early 70s, and he took a leave of absence for 6 months, and with his teenagers, they decided to live on the shore of a beautiful beach in Lake Michigan, and they did pot all day would you believe, with his teenagers. Well, he came back to work. He wasn't the same. His brain had been affected, and I know that if you at least for some people, maybe some are more sensitive than others, but it can make changes in I think in the structure and the chemistry of your brain, and it's not a surprise that some of them might trigger schizophrenia. It
Mhm.
might be a trigger for some people and not others, but changes the brain. It's not a good idea to do this, and, the only people I think it's okay for are people in extraordinary pain. It's the only way they can survive, but it doesn't affect us from fixing a behavior problem or depression or anxiety.
Right. But you haven't been really working because we really need somebody from a nutraceutical point of view, from the scientific nutraceutical point of view, really diving in to what is actually happening with these mostly young men, but also young women who are exposing their poor brains to very high amounts of THC. And the theory is that the schizophrenia was there before, but latent. It hadn't gotten triggered, and the THC is triggering it. But what I've seen over and over again with these people is, first of all, their craving for marijuana does not go away with psychiatric treatment. So they're put into an institution, they're put on high levels of meds for their psychotic break, which kind of sort of work, but actually not really. And then they're released home to their poor families, and the very first thing they do is go out and smoke inordinate amounts of THC or other delivery methods, have another psychotic break, and end up back in the hospital. And round and round we go. And this is a pattern that more and more people are seeing that is deeply disturbing.
Well, I think we've had a little different experience, and I think the reason is we weren't using drug medications. And we found if we have a person, we had many that I worked with that were heavily on pot, and they explained why they did it. They felt so horrible and so miserable is the only way they could feel okay for a while, and so they were taking it and taking a lot of it. But we found that if we could correct them with our nutrient therapy, not drugs, but with nutrient therapy,
Right, right.
most of them said they didn't need it anymore, and they stopped. So we had, but I think that but if you didn't fix the problem and just threw drugs at them to work with their symptoms, they might, have the really nasty reaction, the continuing reaction to it. It seems like we
Mhm.
were able to eliminate it, and it didn't. It was not nearly as addictive, and they no longer wanted it. So I've heard that over and over and over, not every time, but over and over.
Right.
So
That's
anyway,
right.
that's what I talked about, that being quite so awful as the rest.
Nice.
So I think we've sort of covered, all of that, and, I definitely wanna get that information to you. I wanna repeat, we are gonna do our training in March and April, so, but I'd be happy even if you don't do that, I'd be happy to get you whatever information we can.
I would love you to. I would appreciate that very much because I want to pass that on to my highly trained practitioners.
The first thing I'd like to do, I guess, is, find 5 or 6 or 7 really great scientific articles that'll lead you right into it all.
Beautiful. Thank you. And I'm hoping actually I might be able to take your training. That would be really good. So let's talk about bipolar, shall we?
Absolutely. What happened to me with my are you familiar with the book Nutrient Power that I wrote 11 years ago?
I I read it a long time ago and I reread it and I recommend it to all my students.
Well, in that book, I wrote a chapter on behavior, ADHD, a chapter on anxiety or on depression, on schizophrenia. There is no chapter on bipolar. And that's
Uh-huh.
because 12 years ago, I felt I didn't know enough about bipolar to write a chapter that would help anybody. it was bipolar is just has been a mysterious disease. Nobody knew what the cause is. No one understood the reason, the mechanisms why they cycle between mania and depression. And I think that's just been a hindrance. And so what they've been doing really for 70 years is trial and error drug therapy, which has helped quite a few people, especially the lucky ones that do well on lithium. But basically, I used to have lunch with my best friend who was a head of psychiatry at a major hospital in Chicago, and there was one time we were just talking about how terrible it was with bipolar because we could help them somewhat, but it's not enough, and I decided to spend six months studying everything in neuroscience and genetics to see if there's any new clues. There's an enormous amount of neuroscience research. There's 250,000 neuroscientists in the world. Would you believe?
That's a
200,
lot of neuroscientists.
and there are about 1,000 papers and studies every couple months. And some of these things are brilliant, but they get lost because there's some, and, there's in the forest of all the others. So I started doing this, and I was going to spend 6 months hoping to find something that could give me a clue, a way to better help people with bipolar. And it just got so interesting and so exciting. I spent 8.5 to 9 years doing it and studying all of this. And I learned a lot about it. And eventually I got to the point where I believe I have discovered the cause of bipolar. I'm quite certain of that. I presented it at the Society for Neuroscience meeting a year ago in October. Presented it, part of it earlier at the APA. Nobody seemed to be interested. And I would ask these doctors why, and they'd say, "Well, don't you really need a drug to do the job? How am I going to how am I going to treat the patient that comes in next week?" But anyway, so that's why I wrote the book. I want to get everything, all of this information, I- and we're now trying to get this to psychiatrists and mainstream medicine, because not only did we find out what it is, and not only do we have a theory of it, we now know that we can help every single bipolar patient today somewhat. We know, we've learned that it's caused by rather unusual and specific mutations in ion channel genes. Now, ion channels are in the membranes of your neurons, and they really they orchestrate neurotransmission. They orchestrate.
They're really the receptor sites, aren't they?
They
When we
well,
talk about receptor sites that neurotransmitters lodge into, it really is these ion channel.
well, they do that too, but in this case, they are the ion channels are the ones that give the neurons the voltage.
Okay.
And without neurons, and they're the ones that keep the potassium inside the cell and the sodium outside, and that all of that is involved directly in having a neuron even fire. And then, of course, the receptor part is where they transmit to one to the other. But the channels, and it's not a surprise really that it's mutations in channels, because scientists have known for a long time that this was a suspect for bipolar. So anyway, we found out that it is. At least we're sure that it is. 99%. We believe this, although we still have to have it tested by others. But knowing that then we were able to identify what was the cause of switching or cycling, this mysterious aspect of bipolar where people, it usually begins with mania, and it has a lot to do with hyperactivity of neurotransmitters. Well, we found out that it was actually the mania is the cause of the depression. We learned that, and we learned a lot about it. But one of the main things is we learned it was a DNA damage disorder. From the day we're born, oxidative assault by free radicals, cosmic rays, and everything else damages our DNA dramatically. It actually causes every strand of our precious DNAs to rip apart. Would you believe thousands of times a day? And there had, and, there,
I did not know that. When I read that in your book, it was like, OMG, that was really mind blowing.
and that's why people age. And that's why people get cancer. And what happens is that people might be born with a predisposition for, say, bipolar or for kidney disease or whatever. But it doesn't happen usually while a person's a child. It's a late onset disorder. And what's happening is that in the case of bipolar, we found that not only did they have the ion channel problem, they genetically have extraordinary, rapid, accelerated DNA damage. And and what happens is that day by day, month by month, and it usually the median age for onset of bipolar is age 22. It takes 22 years for all that damage to finally dysregulate neurons, and you have bipolar disorder. Once you have bipolar disorder, apparently it's quite permanent, and it doesn't go away. You might be able to treat it, but it's a very complex, terrible disorder if accurately diagnosed. And but also another nasty thing about bipolar is that they've known for years that it gets worse with time and with age. And they thought it was something they called kindling, where the episodes would just incrementally make things worse. And there were theories of why that happened. Well, now we know why. It's because this attack on the neurons, it continues after they have the disease, and it just gets worse and worse and worse. If you know somebody with bipolar who's 20 years old, they might be doing rather well. But if you talk to the person with the same condition, they're 40, 50, 60, they're miserable. And bipolar has the highest suicide rate of any condition, and it's medically higher than schizophrenia, depression, whatever. And we found that not only does it affect because they have this extraordinary oxidative assault, not only on their brain, but their whole body, they're more prone to cancer. They have 2 times double the chance of dying of a heart attack. They're more prone to MS. You name the disease, kidney disease, cancer. They not only have this horrible disease dealing with mania and depression, and that's awful, but they have poor general health and early death. They die 12 years, the population, they drive 12 years earlier. So we learned a lot about it, but one of the thing we don't know how we can affect the genetics of the ion channels, but what we do know is we know how to fix the oxidative assault. And it's a little bit more than the antioxidants that we've been familiar with. We've been familiar with zinc and acetylcysteine. We know about glutathione, and we were doing all of that. We thought we were doing a great job of that, and we were doing the best we could. What we didn't know is there's a family of free radicals called the superoxide family that this didn't even touch. And now all the research studies, I've of course been still looking at them all, they are finding these superoxide radicals in bipolar brains, people who are suffering. They've fixed everything else, but it's like we got 80% of it fixed, but the worst free radicals are, and now we know we're beginning to learn how we can develop new antioxidant therapies, non-drug therapies, and fix that too.
Ow.
Well, the genetically, our genetics protects us in many ways, and the radicals we're concerned with are called superoxide,
Right.
even hydroxyl OH with an electron. That's a terrible, vicious free radical, and then what they call ONOO.
Oh, no. Well, and I've been studying those for the last several years with Dr. Robert Miller.
Good.
And because with his genetic studies, and he's a traditional naturopath, who's taken on very high level genetic research. And so I've studied that quite extensively.
So what happens is that the fact that a person has bipolar is what you call a channelopathy. There are other channelopathies, but ion channel disorders, this with bipolar being a really nasty one. But anybody who has a channelopathy has extraordinary free radical assault and deterioration of your DNA. And with your DNA, problem with the DNA is, what does DNA do for you? And what it does is it expresses proteins.
Hmm.
And in fact, it gives every part of your body has a menu of 80,000 special proteins. It might be receptors. They might be, throughout the entire part of the body. And anyway, so what's happening is our chemistry, the proteins that our DNA is supervising for the body, is getting gradually deteriorating with time. It's why we age. It's why a lot of these, like why cancer develops, and it's why people get heart disease. All these, and it's really interesting to know that, but it's especially severe for bipolar. But we can fix that. And your friend who's working on this, he knows all about the SOD 1, 2, and 3. There are 3 genes that are supposed to do the job of regulating those 3 nasty or free radicals. But some people don't have that ability. And for others, the assault is too great. But for whatever reason, that seems to be the biggest problem causing continual deterioration of the brain for bipolar people. I suspect it's a similar thing for dementia, by the way. So we just learned this quite recently. You can actually go to a health food store and you can buy SOD. That's sodium
And
oxide dismutase. That's
I
supposed to do
actually
the job.
I take it because I have SNPs in my SOD pathways.
Yeah. Well, and a lot of people do. So there's SOD1, which has copper and zinc in it, functioning. Basically, to have an antioxidant, you have to provide an electron, because what do free radicals do? They're thieves that try to steal an electron. And so anyway, our body has these 3 genes that regulate and take care of those 3. And it's a problem that has not been addressed before, and now we know how to do it. The problem is, if you take SOD1 from your vitamin shop, and you'll find it there, it has a terrible time making it past the intestinal barrier, and there are
Yeah.
people developing ways of doing that. But even once it gets in your bloodstream, the half-life of that one is 5 seconds. So the SODs that your brain was making, and it's hard. We haven't learned yet how to effectively get that into the brain to really regulate those, and they tend to be causing nasty problems. And if we could only fix that, for one thing, there'd be less inflammation, less oxidative overload, and they would get somewhat better just because you did that. So we could actually take anyone and do that and get rid of part of their brain problem. It'd be a partial.
So, Dr. Walsh, what about enhancing the function of BH4?
Well, I've worked on that for a while. There are ways of trying to do that.
Hmm.
It's
Because it
something
occurs
that,
to me that the BH4 manages to kind of bypass that whole snarl that, where things can get really snarled up.
for some
And
for some neurotransmitters more than others.
mhm.
Yeah, and especially for a couple of them. Yeah, but
Well,
that's
no,
that's
I'm not talking about BH4 and its neurotransmitter creation function. I'm talking about BH4 in its antioxidant,
yeah.
anti-toxicity function, where it goes down and it helps with the NOS.
It's a problem for a lot of people, but it's not the only problem. Yeah,
Yeah,
it's a
yeah,
way to try to help somebody.
yeah.
We've done
So
some of
you so you can support tetrahydrobiopterin in its antioxidant function.
I believe it's a good one. One of many. Yeah,
Yeah, yeah. What
and
what are other ways you use? If taking SOD by itself is not that effective, what have you found is effective?
found 3 things that are effective. And there are going to be more, because we just learned this in the last couple of years, and partly from the study I was doing on all of this, and getting all the research data of what's wrong with people, with the brains of people with bipolar. For one thing, our old friend N-acetylcysteine, that was good for
Mhm.
the alcoholics and the drug people. There's been very nice research out of Melbourne, Australia, by Dr. Burke, who I think is one of the greatest scientists in the world for mental health. And he has proven that if you give that to bipolar people, they get better. And so I dived into that and found out some articles that showed why. It turns out that N-acetylcysteine increases the function of SOD1 and SOD3, two of the three, and it increases the expression of SOD2, which is SOD manganese. Uh,
Uh-huh.
so now we know why. I'm sure he knows. He's so smart. I'm sure he knows. But so that's a nutrient you can get over the counter that can
You
help
sure can.
bipolar people to some degree and to a significant degree. And I think it has to do because it's one of the things that really fixes all these superoxide radicals that are
Right.
afflicting the brain. Another thing is copper and zinc. SOD1 and SOD3 are both copper zinc. In other words, when a gene is expressed, there's these three SOD genes. When they're expressed, they're what they call apo enzymes, meaning
Uh-huh.
they don't have the metals yet. They're proteins. You get this amino acid or this protein coming, and then they quickly take on the metals. Okay, and if you have a copper or zinc abnormality, it's not going to work well as well, and we know why. Because the copper is it's copper divalent, copper plus plus, and so for it to do its job of rectifying, it has to give up its electron. And but you have the right amount of it there. And manganese, the same thing. You have to have the manganese, which is manganese with three electrons. But what happens is that you have to be able to have the right amount of them there. So that whole system doesn't work well if you have a copper zinc abnormality that's significant. Many of our patients do. Something we can fix really easily. In fact, we could teach all doctors how to do that. And copper zinc usually can be corrected by simply balancing zinc levels.
Right.
You can do a blood test of their zinc, and if it's depressed or if you find high copper levels, we know the reason why copper gets dysregulated has to do with another set of genes called metallothionein genes. But
Right.
this problem can be helped by, first of all, the acetylmethionine. I'm sorry, with NAC, and then we've learned with our 1,500 bipolar patients, if we just fix their metal metabolism and their copper and their zinc, their doctors and they report some clear improvement. I mean, they still
Clear improvement. And I'd like everybody listening to know that Dr. Walsh's range for normal zinc and normal copper, it's a little narrower
oh yeah.
than the conventional range. So I actually have this in a sticky note on my office wall. So I'm going to read from my little sticky note, okay? That ideal copper, according to Dr. Walsh, is between 70 and 110. And
Yeah.
ideal zinc is between 90 and 135, but zinc and copper should be in a 1-to-1 ratio. So I learned that from your book, I don't know, 10 years ago.
Yeah, we found out that if a person has like 30 years ago, I was seeing these violent people with copper zinc imbalances, and I went to a geneticist team at Argonne, and I was trying, and we were trying to, I wanted to do some experiments, and they said, wait, you don't need to do that. We know why that happens. If you have copper and zinc out of balance, it means their metallothionein genes aren't functioning. We actually we have four genes called metallothionein genes that have the job of regulating copper. And for most people, you could be chewing on a copper bar all day and your blood level would be normal because your body corrects it. But some people
Right.
don't have that working. And it turns out the way to fix that gene is zinc. They're right on the DNA. There is a metal regulating unit right on the DNA, and zinc is what causes it to express or not. So we can directly so that's been something I learned about 25 years ago with autistic patients. But and that is the third thing that can help. It can help with these free radicals, the superoxide. So it's the N-acetylcysteine, normalizing copper and zinc, and what I call metallothionein promotion. And I've got a formulation for doing that. have been given already to more than 1 million people, actually, most of them autistics,
Ah,
a lot of that in Australia. So
that's
so that's only,
primarily the zinc.
and it's only the beginning. I think as time goes on, we're going to quickly find more effective ways to really get the superoxide system and getting that to work. It's a
So what about using melatonin for NRF2 support?
I've done that a lot, and I've done a lot of studies with people who reacted well to melatonin, including to people with depression or other problems, and had them take different dosages and look at the, and it helps some people quite well. But it's again, it's something that doesn't directly affect everyone in the same way. It's something that it works, that is far more effective for some people than others, and it depends on
Mm,
it depends which neurotransmitters are misbehaving. So you can't say, well, this is good for everybody. Unfortunately, things are more complex, and human beings
well,
are, and
but
they're
but that's true for everything.
pretty much, yes.
But I was thinking more about its antioxidant effect and its impact on NRF2, because we know that NRF2 is a gene, right? Regulates all helps regulate all these other antioxidant genetic pathways.
And it depends partly on how perfect the nerve 2 system is working. Some people have genetic issues with that.
Yeah, they do.
So there are some people who would be really impacted by this, and the ones that are genetically lucky and have that system working so well, they may not need any kind of support.
Yeah,
So
yeah,
the whole world is kind of complex. The one thing I wanted you to know is that I mentioned that we could now help any person with bipolar, at least to some degree. And
yeah.
the best thing we can do for them is to prevent it from getting worse. But even more exciting is there are studies now showing that most people who get bipolar have a parent with bipolar or a
Right.
major medical history of bipolar. And it appears that the average person is not going to get bipolar. It has it's a genetic, the genetic heritability is so great, and there are some people who are reporting that they think that at least 85% of people who get bipolar had a parent with it, or something really, strong, maybe uncles or whatever. But so that I calculated out just a few weeks ago that in the United States alone, there are 3 million, more than 3 million people between under the age of 21 with a parent with bipolar. And it looks like those are the ones that are most likely to get bipolar. We could prevent bipolar because we can't affect
Yes.
the genetic ion channels yet. By the way,
Right.
gene editing is not going to work, and I don't want to spend time explaining why, but that's not going to help. But the we are developing special antioxidant programs. What we could do, what they could do, and we're trying now finding bipolar families we've worked with who have children who are at great risk, 50 to 100 times greater risk of developing it. We're trying to find them now, and what they can do is go to a doctor. There are no blood tests, urine tests, and even DNA tests that are not that expensive. They could find out whether they have this condition, whether they have the extraordinary rapid DNA damage. We've started doing a number so
That's remarkable.
so you could take these families who might have 5 children, and maybe 1 or 2 of them might have this disease tendency and the others are okay. They can find out right away which ones might have it. And if they have this extraordinary risk for bipolar, we can prevent it today.
So, for
Well,
listeners, because I
exciting.
know that I've got people listening to this who are going to say, well, what do I ask my doctor for? What tests do I ask my doctor for? So, do we send them to your clinic, or can you tell us right now what tests they ask their doctor for?
I haven't had a clinic for 15 years.
Ah,
We now have a new organization, and the clinic, my clinical arm really are the hundreds and hundreds of doctors I work with. But on our website, we have a list of doctors that know these protocols. No, they don't all know this protocol yet because we're just beginning. This is something new. This is just coming out of the study I did, and
okay.
so I'll explain it in the book. But there are very few
So
doctors.
how are people? So I know that I have people who are right now listening to this, or when they listen to this, will say, I have a parent or, I have bipolar and I have 5 kids. How can I get my kids tested?
I think they should check out something called 8-oxo, OXO-DG. And that is the right now the most popular and used test. And see what happens with your DNA when your DNA gets damaged. There's one of the 4 nucleotides in your DNA, which is guanine. Okay, there are 4 of them, and but
Mhm.
that's the vulnerable one because that is where the damage occurs usually, and there's so many DNA in your body, the fragments show up in your urine and in your blood, and it's measurable. And I just learned that just a couple of years ago, and we're trying to develop, and this test has been available for 20 years for something else. But there are now like 7 or 8 commercial tests now that can determine if your DNA is being assaulted dramatically. So a bipolar family could check their children, find out who is at this great risk and which ones don't have to worry about it, and then act accordingly.
And so they just go to their doctor and ask for this 8-oxo-DG test, urine
Well,
test, blood
well,
test.
I'd rather that the doctor would suggest it, but yeah, however it happens, great. But then if they find out that the person does in fact have this great tendency for bipolar, then they can give them a formulation of antioxidants that are very powerful. And I'm trying to devise, and people are asking me to come up with a couple of these formulations, and I'm doing that right now. And I
Wonderful.
within a couple of months actually. But even normal any antioxidants would help a lot, and that would really. So what they could do then, if you have a patient with this problem, you could do the blood test or the urine test, and find out if they have the problem, give them the antioxidant treatment, and then do a follow-up test to make sure that you've actually corrected it. And maybe once a year, if the person's like 4 years old or 10 years old, once a year, check it to make sure that you still have that under control. And it's very likely that they would never get bipolar. That's
Well,
exciting.
this is a miraculous game changer.
Well, it certainly could be. Now, the problem I have is I'm not, the book has been out for more than a month. And I thought there would be just a flood of people wanting to know about this. And it hasn't happened because apparently we haven't got this message yet to the scientific world, to
Well,
bipolar disorder. But we now know how to do that, and we're
you only had 2 pages in the entire book on this antioxidant treatment.
that's right. You're correct.
So I think if you had 2 chapters on this antioxidant treatment, you might, like the information I'm getting from you today, I think you might have more response, because I went through every page of the book looking for, okay, what's actionable and what is hopefully actionable in the future. And I found 2 pages,
It was all in
but
chapter
that
12.
was
Yeah.
that was actionable, and there wasn't practitioner. I couldn't find enough information that was actionable, which is why I invited you onto my podcast to see if I could pick your brains.
Well, we've done the best we can. So what happened, I'd like to say something, and that is that in doing this study, the real excitement for me was when I first discovered the cause of bipolar. And then I discovered it took another year or two to identify why we were getting cycling between mania and depression. And then a little bit later, we did another year of studies, or I did another year of studies, and it got strong evidence that it was serotonin was the neurotransmitter that was actually being affected so much that it was the cause of the switch to depression. And so we got to all of that, and then I developed the theory of bipolar disorder, which I believe is much more
Mhm.
advanced. And so that was the book. And then at the very end, I was thinking, wait a second, what can people are going to want to know? What can we do about this? So I kind of hurriedly in the last chapter, chapter 12, I wrote up, I think it was more than, may have been 3 pages, but I have a lot of this information there.
Uh-huh.
Now there's something called author's remorse. You've written a book, right?
I certainly have.
Author's remorse is when the book comes in the box and you see it and you realize what you wish you had done. If I could do this again, there would be another chapter on what we're talking about. But it hadn't happened in
But
its
you can put that chapter on your website.
yes. Well, we're doing some of that.
Yeah.
We're starting to do that. We have to get this word out that we hadn't really focused on that even when the book first came out. And then it took, I guess it took me a while to realize, oh my gosh, we can do prevention today. And I hadn't thought of, I mean, I mentioned that in the book, but now,
You did.
but it took me a while to realize how many bipolar uh, people who develop bipolar, and we now have 7 million in the United States, 70 million worldwide. I didn't know that virtually all of them, or a huge percentage, have a parent with bipolar.
Mhm.
I didn't know that when I wrote the book. And so I've only recently learned how this could have this dramatic effect today. I thought mostly what our knowledge would assist people and researchers in developing new therapies. I didn't realize that prevention is something that's right there in front of us today.
Well, and every doctor, psychiatrist, but in my world, okay, the functional nutritionist, the people I train, I have a few doctors, but I don't usually get the doctors. I get the people a couple of layers down, right? I get the nurse practitioners, the functional nutritionists,
Okay.
all of those people who have clients and patients with bipolar, who have clients and patients who have bipolar parents, and they have the sophistication, Dr. Walsh, to apply what you are teaching us
Sure.
right here and now. They
We're-
have the sophistication to apply this to their patients and their clients. So I, as an educator, I am passionate about getting what you and I have just now talked about to my community in a really usable fashion.
Well, I've hired many nurse practitioners and other people that have found some absolutely brilliant ones. I once ran a
Yeah.
clinic. The clinic I ran, I once had 5 doctors, and when we would hire a new doctor, I had I think it was a nurse practitioner or a physician assistant. She was the smartest one, and I had them train the doctors, and some of the doctors didn't like that. So I agree with you. There's all this talent that may not have an MD after their name. But anyway, the point is that we're doing our best to get the word out, and we're now making a major. We're actually holding webinars on trying for families and for the very people you're talking about. We're going to have a webinar in January for those people, and we're going to be talking
Wonderful.
about prevention. And so we've now that we're focused on that, we are going to do that. We're a not-for-profit public charity, and I think it's gonna cost something like $80. I mean, it's not going to be $100. Even with the doctors, we're trying to keep all the costs down. We just want to get the word out.
Well, of course, that just like I want to get the word out about eating protein.
Pleasure talking to you.
Pleasure talking to you too. Thank you so very much. And for those of you listening, thank you for listening. If you enjoyed this, please push the like button and the subscribe button and share it with as many people as you can. And go to Dr. Walsh's webinar in January. Dr. Walsh, thank you so much.
Great. Thank you.
Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.